You're about to learn why people get lower back pain, what the obvious and correct diagnosis for that is, and also what it isn't. Now, people like when you get back pain to know what's causing the problem. Is it facet joint irritation? Is it a disc bulge or prolapse? Is it a muscle strain? And of course you can do all these MRI scans, x-rays to have a good look at the things and work out what's going on. However, the GPs, the hospitals, the doctors, they give you a very, very common diagnosis of non-specific lower back pain. And I get many patients in saying, I've been told I've got non-specific lower back pain and it's really annoying me that they're just not telling me what's causing the problem. Unfortunately, that is pretty accurate. It's non-specific lower back pain. And the reason why we say non-specific is because if you've got a disc prolapse in your spine, that doesn't mean it's painful. That doesn't mean that's causing the problem. Maybe 70% of people of middle age have some sort of disc prolapse in their spine, but they don't have back pain. So what we do know is that a prolapse doesn't always equal back pain. On the other hand, someone might have back pain, but have an MRI scan, they go, oh, there's no disc prolapse. So we don't actually know specifically what's causing your back pain. It could be that there is some sort of disc involvement that's causing the pain. It could be that there's some wear and tear in your spine that's causing the pain. But again, with wear and tear, everyone over the age of 70, 60, 70, 80 has wear and tear in their spines, but they don't all have back pain. So of course we then go, well look, wear and tear doesn't equal back pain. It could be a contributing factor, and for you specifically, it might be a big factor, but ultimately what we do to try and correct a problem is we give it a diagnosis, we give it a working diagnosis of disc prolapse, tight muscles, misalignments. But to correct the problem, we can't worry about a disc prolapse or wear and tear because we can't fix those things. We have to look at what we can address and we can fix. We can address things like a misalignment, restriction, if your spine's jammed up and just not moving properly, if the muscles are tight, if they're weaker than they should be and there's instability, all those things we can correct. So the big goal for you is don't get bogged down with, have I got a disc prolapse? Is it causing the pain? Is it a muscle strain? Don't worry so much about that. Do worry about what your spine's doing that it shouldn't be doing. What can you address at home right now by watching my other videos to correct the problem or correct the symptoms by addressing alignment, mobility, strength, stability, all of these things. So jump on my website, on my channel, watch all the videos, do all the exercises, correct a problem rather than worrying specifically about what structure could be causing the pain, because there's no obvious, easy way to find out what structure was causing the pain in the first place.